My name is Andy McAlavey. I'm a GP from Great Sutton near Ellesmere Port, and the opportunity to bid for the Prime Ministers Challange Fund, it comes at an absolutely crucial time, not just for primary care but for the health system in our country. We're working hard, and we're working hard with our colleagues in primary care and secondary care, community care, the local authorities, to actually create teams around practices so that we can provide better care for patients. And I think what the Challange Fund will be able to do is for us to be able to sit back and actually provide some development time, to provide some time for us to think creatively about how we're going to change services and fundamentally transform services, certainly within primary care and secondary care, to meet the challenge that we have. Certainly in Ellesmere Port, close to where I work, there's definitely deprivation issues. There's problems with health inequalities. The age difference between patients, dying in Ellesmere Port as opposed to more prosperous areas of West Cheshire is too great. And we need to be working, certainly in primary care and health generally, with our public health colleagues, because we can get everything right in our clinical practice, but we need to be working as well with the public health agenda to actually change the dials and actually start improving the lot of everybody. So it's learning effectively how to challenge our resources really in those more deprived areas, and how to connect with them well to actually improve all their outcomes. I guess close to home, we need to be talking about how we create better teams. Colleagues talk to me about, wasn't it great years ago when we could speak with our district nurses and speak with our midwives and speak with our health visitors, and I think we need to create that team focus, and we're trying to do that with creating teams around our practices. But that will help, certainly with community nurses, to actually focus a lot of our time on those vulnerable, elderly type of patients who don't always get the best deal. They can generally fall in, and they need greater care and greater management really at a far earlier time, so we can prevent some of those unnecessary admissions for the patients. And listening to the patient voice is crucial so that we can actually change the system and involve patients in how we are changing the system, and I think that's only going to provide a better service for patients. One thing that I do need to address though is access to primary care as well, and that so fundamental to our principles in changing the general practice is addressing access problems, and there's a whole range of different solutions to that. And I think we need to work closely together as practices and with patients and patient support and help, and even with secondary care, to see how we can solve some of these access issues. And that might involve using technology such that patients can actually access good quality primary care from anywhere. And so that's a facility that we can adopt, and I think we should actually invest time and energy and certainly money into actually bringing the information technology solutions into health, and find better solutions for patients.